Welcome back, everybody. I'm Andrea Henry, Director of Strategic Communications and Policy here at the Iowa DOT. In our last video, I was joined by Director Morler and Director Garrett Claybaugh of the Iowa Department of Public Health. The two of them worked to answer many of your COVID-19 health-related questions. As we continue to move through these uncertain times, many of you have submitted new questions about the virus that have been on your mind. Today, I welcome back Director Claybaugh to address some of these lingering questions about the virus, its spread, and ways you can protect yourself and your loved ones. Let's get started. Director Claybaugh, how many days does the typical person have COVID-19 symptoms, and how many days before and after symptoms are present is a person contagious? Also, when would a person need to know to go to the hospital rather than be treated at home?
Andrea, thanks for the opportunity to join your staff today in this updated session of questions for the Department of Transportation. The question you ask is a good one. So let me talk a little bit about symptoms and time frames. Symptoms may appear anywhere from 2 to 14 days after exposure, and those symptoms can include a fever, cough, shortness of breath. There's still a lot that we don't know about the virus. One of the things that we don't know is how long it takes for a person to become symptomatic or when a person becomes contagious. What we do know is that approximately 80% of individuals infected with COVID-19 will experience only mild to moderate illness. Most mildly ill Iowans will not need to go to their healthcare provider or be tested to confirm that they have COVID-19. Just stay home. Isolate yourself from others in your house. Stay home and isolate from others until these conditions are met. You have had no fever for 72 hours, and the other symptoms you've had, the cough, the shortness of breath, for example, those symptoms have improved. And then at least 7 days have passed since your symptoms have first appeared. If you think you might need health care, call ahead first. Your provider can assess you on the phone as to whether or not you need to be seen in the office or whether you can just recover at home. Also, there may be options for you to talk to a medical provider from home using technology.
Great to know. Now, there's been a lot of conflicting reports about testing. Is it true that some county hospitals are not willing to test for COVID-19?
It's another good question about testing, and so I appreciate the opportunity to talk briefly about that. Today, testing is widely available in Iowa, with residents in all 99 counties having had samples submitted to the State Hygienic Laboratory in Iowa City. While early on in the outbreak, sampling and testing was only available from the State Hygienic Lab, today many private laboratories have sampling and testing available. And all results are reported to the Iowa Department of Public Health and included in the department's daily updates, made available to the public on the coronavirus.iowa.gov website.
Another rumor is that children are not being tested. What is the testing criteria?
Another good question, Andrea. Healthcare providers today can test patients as they deem appropriate for COVID-19 infection, and that's done at national reference laboratories. Providers use their own clinical judgment to determine who will receive a test, and those reference laboratories may charge Iowans for that test. Public health has no funding to cover the cost of those particular tests. The State Hygienic Laboratory in Iowa City continues to perform COVID-19 testing as they did at the outset of the outbreak. And they do that testing in accordance with some more strict criteria. For example, individuals that receive priority for testing from the State Hygienic Lab include hospitalized patients of any age who meet the criteria of having fever or respiratory illness, or individuals who are older, that is greater than 60 years of age with fever or respiratory symptoms, including potentially chronic medical conditions like diabetes and heart disease, or individuals of any age with fever or respiratory illnesses who live in a congregate setting like a long-term care facility, a residential facility, maybe a correctional facility. And finally, those that are priorities for the State Hygienic Labs testing are healthcare workers, essential services personnel, first responders, etc.
How long should we be prepared to socially distance and self isolate to avoid spread or resurgence of the virus?
We've talked a lot in this outbreak about social distancing, so I welcome that question. This is a question that Governor Reynolds and staff at the Department of Public Health evaluate and monitor every day. Decisions to continue social distancing will hinge on a number of factors, including daily case counts in communities across the state and hospitalizations and capacities of hospitals to support Iowans who are severely ill. The virus appears to be highly contagious, and so until we have a vaccine to help create immunity to the virus, social distancing and self-isolation strategies are our best weapon against further spread of the coronavirus. Our goal is to stop or slow transmission of the virus, and social distancing is one of the most effective ways of getting that done. As I mentioned in an earlier question, we also know that symptoms may appear 2 to 14 days after exposure and can include fever, cough, and shortness of breath. Once we start that social distancing, it could be up to 14 days and perhaps longer until we know whether social distancing has had an impact.
So, if an employee has to self isolate due to traveling outside of the state and this person is not sick, can other employees still visit that person at night or on the weekends? What about friends or family members that you don't live with?
Thanks for the question about travel. Regardless of travel, it's a good idea to avoid in-person social gatherings of any size at this point. Use alternative ways of communicating with family and friends, like phones, FaceTime, Zoom, social media apps, to keep in touch with friends and loved ones. There are also mobile technology games that enable you to interact with friends while also maintaining social distance. Certainly, we want to continue to check in on elderly and others who may feel isolated, as this is an important activity that we can do. But using technology is the best way at this point of getting that done.
The first confirmed Iowa case of COVID-19 was in early March. Given the slow start to testing for COVID-19 in the state and the fact that many who have it show little to no symptoms, how likely is it that the disease was present in Iowa in January and February?
As I've mentioned, there's much that we don't know at this point about the coronavirus. Data is now posted on the coronavirus.iowa.gov website, and it suggests that there may have been Iowans affected by the virus as early as February. But these are also likely cases that resulted from international travel and were identified while those Iowans were outside the state. We need more research, and that will allow us to better understand the arrival of the virus and its spread throughout the state.
Can you tell us the percent of COVID-19 cases who have died as opposed to the seasonal flu? Should we assume that the COVID-19 percentage is even higher since there are likely many undocumented cases of COVID-19?
Because widespread testing has not been performed nationally and in Iowa, it's difficult to calculate an accurate estimate of deaths among those who have had the virus. So we don't currently have an accurate death rate for Iowa. Nationally, about 0.1% of all individuals with influenza-like symptoms died in the 2017-2018 influenza season. This amounted to approximately 61,000 Americans in that season. Once we have more data, we'll be able to more accurately calculate the death rate from coronavirus for Iowans.
Interesting. Obviously, we are still in the first cycle of COVID-19, but do we know if there will be a second cycle of this virus in the future?
Andrea, great question with regard to a second cycle of the virus. Again, as I've said before, we don't know a lot about this coronavirus. Further research will help us to understand whether individuals exposed to coronavirus will have immunity for 1 month, 1 year, or longer. Since we've only been aware of this particular coronavirus since November of 2019, when it was identified in Wuhan, China, we haven't even been through an entire year. So we don't understand whether there is seasonality to the virus. Our community mitigation steps continue to be key. In the meantime, avoid close contact with people who are sick. Certainly stay home if you're sick, except to get medical care. Cover your coughs and sneezes with a tissue. Wash your hands often with soap and water for at least 20 seconds. And if soap and water is not available, certainly you can use hand sanitizer that's at least 60% alcohol based. Clean and disinfect frequently touched surfaces and objects like tables, countertops, light switches, doorknobs, and avoid those social gatherings of 10 or more people, practicing social distancing all the time.
So you talk a lot about how to avoid the virus, but what about effects of medication? Does ibuprofen make you more susceptible to getting the coronavirus? And if I do get the virus, should I avoid taking ibuprofen?
Andrea, thanks for the question about ibuprofen. CDC is currently not aware of scientific evidence establishing a link between the types and class of drugs called NSAIDs, ibuprofen, naproxen, and a link between use of those drugs and COVID-19. CDC will certainly continue to monitor the situation and will review new information on the effects of those drugs and COVID-19 disease as it becomes available.
When going to the grocery store, what tips do you have for protecting employees and shoppers? Should we wear a mask or wipe down carts and credit card machines with wipes?
Some things to consider when shopping during this time. Number one, plan your visit. This isn't the time to browse or impulse shop. Consider planning your visit during off-peak hours to limit interactions with other shoppers, and avoid bringing family to the store. Designate one shopper to do that work at this time. Secondly, CDC encourages shoppers to wear a mask. This doesn't allow you to avoid social distancing, so continue to stay 6 feet away from other shoppers. But the mask could be an additional level of protection for you and others in preventing virus spread. And third, when you arrive home, wipe down your purchases with disinfectant. While there's no evidence that food or packaging is a vector in spreading the virus, taking the extra precaution of avoiding touching your face after placing items in your cart or in your pantry can help assure that spread will not occur.
Finally, can you tell me how long the coronavirus lives on different surfaces?
Again, there's so much we don't know about this particular virus. 2 other coronaviruses have emerged previously to cause severe illness in people. You may have heard of MERS-CoV and SARS-CoV. The virus that causes COVID-19 is more genetically related to SARS-CoV. While we don't know for sure that this virus will behave in the same way as those viruses, we can use the information gained from both of these earlier coronaviruses to guide us in our decision making. And what we know is, in general, because of poor survivability of these coronaviruses on surfaces, there's very likely a very low risk of spread from products or packaging or surfaces.
This has been so helpful. Thank you once again, Director Klebaugh, for taking the time to help our employees better understand COVID-19. As we've stated before, the safety of our employees is our number one priority. During this time, we feel one of the best ways to keep you safe is to arm you with reliable information and tips that you can utilize both in your professional and personal lives in the fight against COVID-19. We hope you find this video helpful in keeping you safe and informed. Remember, we're all in this together. Thanks for watching, and stay safe in all you do.